Now it's timing.
Okay, so now it's filming. All right. So this is the basic head, ear, eyes, nose, throat assessment. First, I will take a look at my patient and look at the hair distribution. Look at the scalp. The scalp should be pink. Look for any lesions or masses. Always starting with inspection first. I'm going to look at the contours, distribution of the hair. Now I'm going to palpate. Feel for any masses. Back here, feel the occiput. Any tenderness back there?
No.
Okay. Moving down, I'm going to feel the temporal pulse. Palpate that. Any tenderness when I palpate there?
No.
Okay. Now I'm going to move down and palpate the temporal mandibular joint. Do me a favor and open and close. Open and close. Good job. Any pain when you do that?
No.
Okay, good. Next, I'm going to check your sinuses. So what I'm going to do is palpate the front, around the nose and the top of the head. I want you to tell me if you feel any pain or tenderness.
No. No. No.
Okay, very good. So next I'll move on to the eyes. Checking for symmetry, checking the eyelashes, seeing if there's any abnormal hair distributions, any lesions, redness, checking the sclera, making sure the conjunctiva are clear in the eyes, no redness or yellowing or jaundice in the sclera. I'll pull down and check the eyelids here, which should be nice and pink and moist, which they are. That is the pupil conjunctiva. Next I would take an otoscope. Since I don't have one, I'm going to use the light on my phone here. And I'm going to check for reflexes, symmetry, color, any foreign bodies that I would see in the eyes, the pupil, the sclera. So look directly at my nose. Very good. Very good. I can see that the pupils are equal, round, and reactive to light. Now I'm going to check for direct and consensual pupillary reaction. Direct would be when I shine the light directly into the pupil, that pupil should constrict, which it does. Consensual would be when I shine the light into that same pupil, the opposite pupil should also constrict, which it does. Okay. Also, when I was looking, checking for foreign bodies and any abnormal coloring, which there was none. Okay, so now I'll check the visual fields. This test checks your peripheral vision. So what I'm going to do is put my hands on the side of your head. I'm going to start in the back and move forward. You just tell me when you can see.
You can see it.
Okay.
I can see it.
Okay. Now that was checking the inferior and superior fields of vision on both sides. Now I'm going to go directly.
I can see it.
Okay, very good. All right. Now I'm going to check the 6 cardinal views of gaze. This checks the extraocular muscles. What you're going to do is follow my finger with your eyes and only your eyes. Don't move your head. Okay, so I'm going to go out, up, down, back to midline, out, up, down, back to midline. Okay. Now the next thing I'm going to do is take my fingers and bring them into the bridge of your nose. I want you, with your eyes only, to follow my fingers to the bridge of your nose. Okay. And this is checking convergence, which is good. All right. Next, I'm going to do the near test. What I'm going to have you do is look at my finger, and then I want you to look away at something in the distance. And what I'm checking for is that your pupils constrict and dilate. Constrict when you look at my finger and dilate when you look away. So look at the finger. Okay, now look at something far. Okay, and they are reacting appropriately. The next thing that I would use is the otoscope and look for the red reflex. So since I don't have that, I'm going to simulate it. What you would do is line it up. I'm going to check your right eye, so I'm going to use my right eye to look into your right eye.
The dog's flying out there like mad.
I know. So what I'm going to do is I would hold it to my eye, look into your eye, look for the red reflex, and move forward once I find it, very close. And then once I get close enough, I can then look at the internal blood vessels and the optic disc and all the internal structures. Again, checking for any abnormal signs like swelling, redness, tenderness to light, or photophobia. Okay.
Did you see anything?
No.
I have cataracts. Did you see them?
No. Ears. Next I'm going to move to the ears. Again, starting with inspection and then moving to palpation. I'm going to check the external ear canals, looking for any redness, swelling, erythema, discharge. I'm going to do the tug. Okay, well, now I'm going to tug on the auricle and the pinna, checking for pain, any pain.